to present yourself for this type of study?
We have a question over in this corner for Dr. Kyle.
Yes, first of all, I just want to, on behalf of everybody here, express my thanks to all of you for taking the time out of your days to come. You can't possibly imagine how important it is to us that you would take the time to be here with us and to share your expertise, so thank you very much for that. Two questions quickly. This was the first time that I had heard that the serum free light chain analysis test, the free light test, should not completely take the place of the 24-hour urine and the bone marrow biopsies. So I was going to ask Dr. Kyle if I could get just a little bit more clarification on that. And then my second question is it possible for there to be a delay in the bone pain from lytic lesions? Can bone pain that wasn't present occur months or years later?
The first question is, does the free light chain replace the 24-hour urine collection? And Dr. Finlay may have a different answer than I do, but my answer is that so far we need to still use the 24-hour urine collection, and if the patient has a measurable spike in the urine, that should be done to follow the patient. And I'll just go one step further, and if a patient has a spike in the serum, then that should be used to follow the patient. The free light chain test is a wonderful test for the patient that does not have a measurable spike in the serum or urine. Also, as Dr. Finlay mentioned, it's very helpful in screening. It's also very helpful in prognosis of patients, particularly those patients with monoclonal gammopathy of undetermined significance or solitary plasmacytoma of bone, and also play a role in prognosis of both smoldering myeloma and multiple myeloma. In short, it's a helpful test, and it really doesn't replace all of the other tests. You need to do them in conjunction with each other and look at them. And the final thing I want to emphasize about laboratory tests are great, but the physician must look at the patient first of all and take into consideration the history of that patient, the physical findings of that patient, all of the other laboratory data, and then make a decision as to whether to treat or not to treat, or change treatment, or to stop treatment, or whatever. Look at the total picture and never trust a single laboratory test. Look at the patient first. And your question about the lytic lesion and the pain, yes, many patients can have very large lytic lesions and have no pain whatsoever. And oftentimes as that lesion will get larger, if the patient, for example, has multiple myeloma, not been treated, and as that lesion gets larger, it can cause pain, or more commonly can cause a fracture, and obviously the fracture is very, very painful, and that can occur a long time after the presence of a lytic lesion.
I also have a couple questions. I started wearing a back brace about a year ago, and then was diagnosed like 4 months later with multiple myeloma. I'm wondering, and I can't be without my brace for more than 5 minutes if I'm on my feet. My back really starts to ache. And am I going to be wearing this the rest of my life, I guess is my question. And the other thing that bothers me is I have a lot of creaks and cracks and stuff in my neck. And I'm wondering what that's about and what I can do about that.
The question relates to the use of a back brace and as well as discomfort in the neck. With a back brace is something that you have to kind of decide on an individual basis, because if you're in a back brace continuously and hold your back steady, your bones will generally get more fragile as time goes on, and so the risk of compression fractures is greater. At the same time, if you have severe back pain and can't get out of bed, well, just lying in bed, your bones are going to weaken as well. So I think that you should try to follow a middle of the road. That is, get up and move around a bit without your brace if you possibly can, and then when you get to the point where you have pain, significant pain, then you need to put it on and to keep going, because the bottom line is that you need to be mobile and try to wean yourself away from the brace if you possibly can. The other point about the cricks and cracks in one's neck or knuckles and so forth, it doesn't mean anything per se, and is more of concern to the patient than it is of practical significance. So don't worry about those little cricks and cracks.
Oh,